Christina, I believe it was your suggestion that we RSVP for quorum via a Zoom link and via the invitation. Are you finding that easier? Yes.
Yes, I am. Thank you, because I get so many emails. You're guaranteed to get an answer when I put it on my calendar.
Great. Thank you. Hello, Chair.
Hello. How is everyone doing?
Great, thank you. It's nice to see you again. We were just in back-to-back meetings. Thank you for jumping right over.
Yes.
Chair, we do have quorum, although you might want to give it another minute or two. I do think we have several more people joining us.
Super. Yep, we will be sure to do that. We'll just give a couple minutes since it's just 2 o'clock now.
Also, Chair and Vice Chair, I did want to let you know that tomorrow is Cindy Savarino's last day with DES. She is retiring as of tomorrow. So I don't know if she will be joining us today or not. We have reached out to the Director of DES for an appointment to fill her spot, and we will keep you posted on that.
Super.
Kelly, did you, when I present, will I be able to share my own screen, or were you going to bring up the slides that I emailed you? Because I think I've edited them since then. Not grossly, but a little.
We have posted the slides that you sent publicly, which is what we do with all of our presentations. And we do have your slides ready to go. But if you do want to instead control your deck, that is an option. So it's up to you. We just need to let Jeremy know, who's on the call with IT. Okay.
You know, if I can use the slides that I've got, they'll be a little bit more relevant and updated for this group. And so I'll present if that's okay. And then I can send you those as well right now so that you have those and you can swap them out.
That'd be great. Thank you very much. You do have the ability to share your screen now. Thank you, Jeremy.
Okay. Thank you.
Chair, I think we can go ahead and get started at your leisure.
Wonderful. Thank you. Good afternoon, everyone. I want to welcome each of you, as well as our guests to the February NAG Human Services Technical Committee meeting. As a reminder, please turn your mics on and clearly state your name before speaking to ensure that members of the audience can hear you. And please mute your mics when not speaking to eliminate any feedback noise. And because this is a virtual meeting, a roll call vote will be taken for each action item on the agenda. Phone-only attendees will need to press *6 to unmute themselves. And Kelly, would you please take roll call for the members?
I'd be happy to, Madam Chair. Thank you. Renee Ayers Benavides.
Present.
Melanie Dykstra.
Present.
Naomi Farrell.
Present.
Autumn Grooms. Susan Hallett. Marilyn Kasanick.
Here.
Chris Lopez.
I'm here for Chris. This is Jerry Guajardo.
I'm sorry, Jerry. I have an older roll call. I apologize. Jerry Guajardo, City of Avondale. Vice Chair Matthews.
Present.
Christina Panatescu.
Present.
Karen Bishop on behalf of Leah Powell.
Present.
Cindy Savarino. Chair Jacqueline Edwards.
Here.
Did I miss anybody? Thank you.
Very good. On to agenda item number 2. This is an opportunity for the public to comment on the agenda, which was provided ahead of the meeting. Did we receive any comments, Kelly?
No, Madam Chair, we did not.
Okay, wonderful. Then we will move on to agenda item number 3. So this is the approval of the December 9th, 2021 meeting minutes. Are there any questions before we entertain a motion to approve the meeting minutes? Hearing none, is there a motion to approve?
I'll make a motion to approve.
Oh, great. We have a motion to approve. Did that come from Melanie?
It did.
Super, thank you, Melanie. Do we have a second?
This is Renee, I'll second.
Thank you, Renee. We have a second from Renee. Kelly, would you please do a roll call vote of all the members participating?
Yes, Madam Chair. Renee Ayers Benavides.
Aye.
Melanie Dykstra.
Aye.
Naomi Farrell.
Aye.
Mary Lynn Kasanick.
Aye.
Jerry Guajardo.
Aye.
Vice Chair Jason Matthews.
Aye.
Christina Panatescu.
Aye.
Karen Bishop on behalf of Leah Powell.
Aye.
And Chair Jacqueline Edwards.
Aye.
Thank you.
The meeting minutes are approved. So we will dig into, we have 3 presentations today. Thank you so much, Kelly, for organizing this on behalf of the committee. Everyone, part of the committee, please, as you're listening today, if there's other presentations that you're thinking about or specific pieces of information that you hear today, please make sure to note those and want to ensure that we are bringing material that is beneficial to all members and providing that information. So agenda item number 4. This will be presented by TJ Reed, MAG's Regional Homeless Project Manager. I will say that is just for a few more days. TJ will be coming to Maricopa County, so thank you. In the meantime, TJ will be sharing the regional strategies identified in the plan and the timeline for implementation. So, TJ, the floor is yours.
All right. Thank you, Madam Chair and members of the committee. Let's see. I can't see. Is it? Oh, there you go. Thank you, Kelly. So I apologize in advance for those who have seen some of this information. Many of you on the call we have worked with to develop this out. We want to make sure that there's a level playing field and that everybody really understands where we're at with the regional strategies and regional plan. So next slide, please. And I also apologize. I am a bit sick, and so I will try my best not to cough in your ears, but if I do, I'll ask for some grace from y'all now. So for those who haven't seen or looked more recently at the point in time count numbers, we have seen consistent growth and increases in our area over the last several years, and early projections, we're not sharing numbers at this point, but we anticipate it being the same for 2022. So with numbers and with homelessness continually rising, there's no way to ignore this, right? This is something that as a community, we need to act on. Next slide. And so for many of you who may have been either involved from the very beginning or maybe towards parts of the end, this is to provide a timeline of how things have progressed with the regional strategies and regional action. So starting back in January in 2021, there was research and outreach happening. And I'll show you a slide of all the types of outreach that were going on, but it was really a thorough review of national best practices and engaging with our local stakeholders to really get an idea of what could be done on a strategic level systemically to really impact homelessness. And that's really where from April to May or March to May, regional strategies were adopted. They were much more high level emphasis of, okay, what can we focus on more philosophically as an approach to address homelessness? And from there, it really went into how do we make these more tangible, more practical, moving from high level philosophy or strategy to action steps. And that's when the action plan development happened and occurred for several months and then was finally approved in December of 2021 by the regional council. Next slide, please. And the next slide. So now we'll get into what those regional strategies in May actually included. And so to develop those regional strategies, this is really what went into it. I'm not going to read all of this, but it was a lot, right? There were a lot of efforts to engage with the right folks at the right time to ensure that this was data informed, it was driven by the community, and was informed by best practices, and not just something that was one person or entity deriving what is best for an entire community. Next slide, please. And so what it really boiled down to is these three categories here. And so on the outreach side, which was much more localized, we held forums and had capstone events that it really included lots of diverse stakeholders. We had surveys, different presentations to solicit feedback, research that involved utilizing data from our homeless management information system, looking at our local inventory, national best practices, development of tools, which hopefully you're all aware of the hand up tool by now, but it's a tool that really looks at our capacities and our strengths paired with what the need is in our community. And then finally, the strategies, which really involved a range of 14 different strategies that were adopted in May. Next slide, please. And so these 14 strategies are what's listed on the board. And so you can see that they fit into these 5 categories of diversion, prevention, housing, coordination, services, and temporary housing. Again, I'm not going to go through all of these. This slide presentation and this deck is there for you if you're wanting to look in more detail. But this is, again, what really drove the details of the action plan, which was more recently developed. Next slide. And so with the action plan, next slide, we really dug into working with many of you and almost every single member agency to really understand where the priorities were, what the strengths and capacities and interest levels were. One of the parts that I enjoyed most about this is, which was a lot of time, but it was really great, is being able to meet individually with many of our member agencies. I think we held 27 overall with offers out to every single one. And I got to drive to some places that I haven't been to in a long time, but it was really great because every community and every local jurisdiction works differently, right? In the sense of what their priorities are, what they're dealing with, right? We have such a varied group of people that to really get together and agree to something was somewhat of a feat in and of itself. And so with that, here was all the work that kind of went into that. There was a regional coordination teams, which were basically invites that had anywhere between like 40 and 60 people from all of our member agencies. We worked with our continuum of care management committee and regional council, and then individual meetings, and then other community stakeholders as well. Next slide. And so similar to the regional strategies where it broke down into 5, our regional action steps broke down into 3. One is committing to the work regionally. The next is safe housing, and the last is diverse partnerships. Next slide. So I'm not going to read all these, but I'm going to highlight a couple of the things that really stood out to folks. One is there was a really big interest as a region to say we all want to do something, right? Whether we're the smallest or the largest, everybody wanted to be involved, because whether you saw 0 on your point in time numbers or you saw thousands, right? There are people at risk in every single one of our communities. There is concerns with the amount of spread that we're seeing that even if you're not impacted now, you will be shortly. So that was something that was shared by all of our partners. And another big one on here was regional public education campaigns. People want to be on the same page, specifically around homelessness, but also around affordable housing and workforce housing. How do we message these things appropriately to where we're providing really data-founded examples of what this means, and not necessarily just all speaking different languages to our different respective jurisdictions. Next slide. The next one, obviously, you can't really have a homeless action plan without housing. So these two top ones are really focused on increasing temporary housing, which is things like emergency shelter and transitional housing. And the second one is permanent housing, which is really dedicated either units and or vouchers for people experiencing homelessness. Many of these on this one in particular were already funded or supported by other folks. So increasing access to and maintaining rental units. This is a project funded by the county, which actually Mike is on the call. They're working on really a landlord engagement effort to incentivize, mitigate damages, and really encourage landlords to partner related to homeless housing. The city of Phoenix is funding to improve our coordinated entry system and evaluate it. And there are lots of things in here that are already underway. But the whole goal of this particular action step category is to really ensure that our housing options for people experiencing homelessness are increased, whether that is on the prevention side of things where people don't have to leave their own homes, or whether that is once you're already homeless, you have an option to go into a shelter. You have an option to go into permanent housing. Next slide, please. And the last one, I think this is something that I've said plenty of times before too, but sometimes I feel like it's good to repeat, is that like homelessness oftentimes is seen as like separate and this thing in and of itself. But like homeless people aren't just homeless, right? You're homeless because of other stuff. And so we have to really partner and work with diverse partners to really address this. That involves criminal justice, that involves mental health, substance use, medical, right, employment. All of these are factors that really are root causes of homelessness. And we cannot just solve homelessness by focusing solely on one avenue. We have to work together and work with diverse partnerships. And so what's listed here are just action steps focused on that. And the last one in particular was of interest by almost all of our member agencies, and that was to form interdepartmental teams. Many of our local jurisdictions are encountering homelessness in all of their different departments. So their libraries might be, their police departments, their fire departments, their parks and rec team, right? And so, but they're all responding differently. And how impactful would it be if they could work together and engage with other external partners to identify standard process to really address that in an effective way. Next slide, please. All right, and so some of the next steps that are happening right now, next slide, are really the emphasis for anyone to get involved, right? And so we're implementing the plan. So all of those action steps are being done by many of you on this call, many of our member agencies and partners. There are ways, and why we have this slide is to honestly share with anybody. So you can pitch this out to anybody if they're interested in the regional efforts, because there's ways to donate, there's ways to volunteer, and there's other ways to support. So we'd encourage you to use these links you can get a better understanding of the more detailed plan if you're interested. And then the rest of the links are really how people can engage with the efforts. Next slide, please. All right, and so as Jacqueline mentioned, so my last day is tomorrow. So I have Amy and Katie Gentry's information here. Katie Gentry will be the primary contact for this. So if you're interested in engaging or setting up things more, I would recommend reaching out to her. But as you all know, Amy is more than willing to support as well. So if you're needing backup there, feel free to reach out. And with that, back to you, Madam Chair.
Thank you so much, TJ. Is there, do we have any questions or comments? Wonderful. Well, TJ, thank you so much for sharing this information with the group. I know there's been such a significant amount of work that went into creation of the plan. And so it's wonderful to see it come to fruition here. Thank you for your time. Wonderful. So on to agenda item number 5. As I mentioned in his presentation, There is landlord engagement activity happening, and that's with Home Inc. And want to invite Michael Shore, CEO of Home Inc. So Home Inc. operates permanent supportive housing and rapid rehousing programs for vulnerable individuals and families experiencing homelessness and housing instability across the state. So Mike will share how Home Inc. works with Access and other funders to help vulnerable individuals find and keep housing. And this item is for information and discussion. Mike, the floor is yours. Thank you so much for being here.
Thank you, Madam Chair and members of the committee. Seeing a lot of familiar faces here. So I'm going to do a fairly high level presentation of the services that we provide at Home Inc. And I'll focus in on some of the things of interest and cover some of the new innovations and specifically the Maricopa County funded landlord engagement service that we're standing up. So just to confirm, Kelly, are we seeing the screen here? Perfect. Okay. Let's see if I can get it to advance. Okay. So our why, everybody has to have a why, right? Thank you, Simon Sinek. At Home Inc., we believe that individuals, families, and communities are safer, healthier, and stronger when everyone has a home. And every day we are dedicated to building communities where the promise of home is a reality for everyone. So it's such a good why. It can be all of our whys, so share. But what we do is, as Madam Chair indicated, we operate permanent housing programs for individuals and families and youth and elderly and veterans, and we're very agnostic for those who are experiencing homelessness and housing instability. And we do that primarily through partnerships, and we operate permanent supportive housing and rapid rehousing. And just an update, you can see we've had some pretty significant growth in the programs that we operate in the last few years. We are nearly serving 5,000 households across the state. And for February's housing assistance payment run for all of those households, we sent out over $4 million in rental assistance just on February 1st for those rents. We do this through partnerships. So interestingly enough, for those of you who don't know, Home Inc. is a real estate company. We're a for-profit entity. And so we are contracted by the organizations, many of which your communities and cities and counties and state fund through various programming, including the HUD-funded Continuum of Care program, ESG-funded programs, City Housing Trust Fund. It really doesn't matter. There are a number of different funding sources. And these organizations then hire us to do scattered site rental assistance, so voucher type work. And this is how we do it. As you know, there are site-based developments of permanent supportive housing where generally all of the residents at a property are receiving services on site. And it is a dedicated building generally, or maybe has a certain number of units set aside in the building for the population that is the target. But there's also scattered site tenant-based rental assistance, and that is our model. So in either case, they both require, the ongoing monthly rental assistance and supportive services in order to work. And our model is unique. This is not something that you see in most communities. In most communities, if we go back to that partner page, each of those agencies would be operating a scattered site tenant-based rental assistance model themselves, either rapid rehousing or permanent supportive housing, alongside the housing authority, right, who's operating the housing choice voucher program. In our community, with Home in its role in the ecosystem, as we say, we have centralized the administration of that rental assistance for the homeless services system, primarily in these doors. So those 4,900 units or households that we provide assistance to, that's on behalf of mostly the entire continuum of care and homeless services system. That is not ours alone. That is our system's investments to end homelessness. In terms of the model, very simply, the participant in the program pays 30% of their adjusted household income each month as their share of the rent and utilities. We then pay the balance of the rent to the landlord each month, and we do the housing program management, eligibility, rent calculations, HQS inspections, rent reasonableness, all the fun compliance paperwork stuff. And then our partners then get to do what they do best, and that's focus on being world-class housing stabilization case managers, right? Getting people to stick in housing and to, continue on their journey towards self-sufficiency and improved health outcomes and everything else. But we're not sleeping well at night right now, I'll tell you that. I'm up late every night trying to figure out what else I can do to get people housed. As you all know, we have historically, I could put historically in front of each of these bullets, historically escalating rents, outpacing our housing program's reach, historically low vacancy rates in the community. If you read the Phoenix Business Journal, about once a week, we get an article from Angela saying that we had another 6 apartment complexes sell to institutional owners from out of state who are going to fix them up and jack the rents. We cannot keep up with the ownership changes. We have evictions going on. And even, if it's not a formal eviction, because we have seen some decreases from some of the protections that have been put in place through the CARES Act and some of the other efforts locally. But we see a lot of non-renewal of leases, right? So people have a 12-month lease, and at the expiration, they get a notice from their landlord that they won't be renewing that lease because the landlord seeks to get a higher rent from a new tenant. And we do not have protections in our community for people who have vouchers as their source of income to pay rent. We do not protect them. And so people who have rental property to rent can simply just not accept vouchers. That's not against the law. And we have more and more owners opting out of programs. And some of the reason for that is that the programs are very stigmatized. They're not always the most efficiently and effectively run programs. There's, a lot of, I think, challenge for the local housing authorities to operate a very good Section 8 voucher program because, frankly, Congress has reduced their administrative fees considerably since 2003. And so it's a lot to ask of them to run a good program at this point. But late payments, late inspections, things like that rubs off on all of us who are trying to operate voucher programs in the community. And so we're seeing a concentration of our participants at fewer and fewer properties in more and more concentrated neighborhoods. So we don't just sit on our hands, though. We're doing our best. And so we try to innovate and learn and apply new thinking. And so we've got 2 things that I'll just briefly touch on. And the first is threshold. And this is the system that TJ was speaking about, which is also in the regional plan that he just reviewed. And then Padmission, which is our web-based housing search platform that we use to manage some of our landlord engagement and housing search. So on threshold, again, this is funded by the county, initially through the Rescue Plan Act and then long-term through general funds. This is a new systems level intervention to the homeless services system. So this is like coordinated entry or like HMIS. This is a layering on top of the existing housing programs that we operate that make them stronger and more attractive to landlords. So it is Maricopa County's centralized landlord liaison service, which supports all scattered site permanent housing programs in the continuum of care. And as its operator, we will be supporting and collaborating with property owners to be active partners in solving homelessness. And this will benefit not just Home and its partners, but any operator of a scattered site tenant-based rental assistance program that is, number 1, dedicated to ending homelessness. So this is number 1 has to be for homeless. Number 2, the referrals for those programs must come through the continuum of care's coordinated entry system. Number 3, the program must be entering its data into HMIS. So as you can see, we've created this out of the county to support and enhance the homeless services delivery system. This is not the county's regional landlord engagement mechanism on behalf of all programs. And specifically, I'll just call it out and we can have a conversation about this. This is not benefiting the housing authorities in their efforts to lease up their regular Section 8 voucher program. What's in it for property owners as far as their participation? We're offering some pretty significant financial incentives, 1.5 times the monthly rent as a sign-on bonus. That's high. Assurance that obviously we're going to be making that $4 million payment timely via direct deposit every month. Dedicated owner support team here at Home that's focused exclusively on serving owners, almost like landlord case management as opposed to the participant case management. The software we'll talk about in Padmission just briefly. And then we are moving all of the risk mitigation funding, right? Damage claims and vacancy loss payments that owners can make a claim against to this program. So rather than having to deal with each individual program or the ADOH landlord incentive program, this will now be our centralized place where we will take care of landlords out of this program. And then finally, this is more of a tool than anything, but just to kind of give you a sense of what we continue to do in leveraging technology solutions to hopefully get better outcomes, as we did in 2019, launch a web-based housing search platform that our participants and their case managers use to search for housing that accept our housing programs that have availability in relative real time. So you can see here just a screenshot that landlords and property managers are able to list and market their properties to our participants, and it has expedited the lease up and the vacancy time. Participants and case managers are finding that a little bit better than an Excel spreadsheet, a paper list, or even some of the commercial products that are on the market that don't necessarily give us any indication as to whether these property owners take programs or anything else. So as I said, even though we're up at night, we're trying to bring new thinking to the sector all the time and continue to add value and make sure that we're ending homelessness for as many people as possible. So with that, the one thing I didn't show, and I'm just going to switch quickly over here to my website. Is this still being shared? Are you seeing the website dashboard? Great. In October of 2021, together with our partners, Arizona Behavioral Health Corporation, we also were selected by Access to become the new centralized statewide administrator of all of the Access funded housing programs throughout the state. This is about $28 million that serves primarily those with serious mental illness in our communities, but also some folks with general mental health and substance use issues. And that's about 2,500 units of housing. And in addition to the units, there's about $400,000, so it's not a lot of money, $33,000 a month of eviction prevention funding. And so right now, clinical teams for people with serious mental illness are submitting to us applications for assistance with rental arrears, utility arrears, and a little bit of move-in assistance. And as you can see here, this is this month already. We've had 58 applications totaling just over $100,000. We're only able to spend $33,000 each month in order to maintain our budget. We may be increasing this in the future, but I think there's a really good opportunity. And I know that there's some presentations coming soon with Access and DES about all these excess applications, this excess demand that I have. How do I get those folks into your guys' hands who are administering the ERAP and other eviction prevention assistance, so that they're not left with these same problems that Access funding cannot contribute to. So if you have any other desire, the Home Inc. website here under performance has a number of dashboards. We're very transparent with the way that we're performing in terms of our efforts to get people housed, the number of move-ins that occur. So feel free to stop by and visit those. And I will pause and be ready for questions.
Thank you so much, Mike. Are there any questions?
Madam Chair, I have a question, if that's okay.
Yes, please, Kelly.
Mike, I noticed on one of your last slides, there was a GSA breakdown with budgets. And the Southern GSA, the Southern REBA had $0 allocated. Can you talk a little bit about that?
Yep. So in the behavioral health world, we have 3 regional behavioral health authorities throughout the state, one in Northern Arizona, Central Arizona, and Southern. And as of right now, this month, the requests for eviction prevention have not been coming out of the South, and frankly, the month before. And so really in our taking over the Access funded housing program and this eviction prevention dollars, we need to do a better job of getting out there to make sure that everybody across the state understands that these programs are out there, they're available to their members, and how to access them. So a little bit of that is just education and outreach that we need to do a better job of. So.
Thank you.
Great question. Yeah.
Thank you. Christina.
Thanks. That was a great presentation. Very interesting. Would love to continue to learn more about it. I've bookmarked the website and banned the page on Facebook. So, but my question for you is, in what way specifically can the members of this group support in this effort? What's missing that municipal human service employees or leaders in particular could help with?
That's a great question. And I was actually teed up to answer that and did not. So thank you for reminding me. One thing is that threshold, when it is ready to go, because we are still in the process of developing out the website, the marketing materials, and the call to action, right, to landlords and owners. We'll be working side by side with the Arizona Multi-Housing Association, departments of realtors, et cetera, to make sure that we have access. And there will be a road show, but we will be providing you all with that material and media toolkits and things like that. Because really, we would love for you, to the extent that you would be champions of that when you're having the opportunities and speaking with landlords, property owners, managers, to remind them we have this centralized one-stop shop for people to offer their residential rental units to people, to end homelessness. So to help us be an evangelist of Threshold would be the biggest ask. And then the cautionary tale, and this is, Renee knows this, Home Inc. ultimately as a subcontractor, right, and administering programs that are specifically for the homeless population, the front door and entry point to that is our community's coordinated entry system and the various access points. And so it's just important. We have a lot of families and individuals who walk through these doors from, just the streets, and they've heard that Home offers a lot of housing vouchers, and they say, how do I get this voucher? So that'd be my ask, is just please don't have people show up asking for the Home Inc. voucher, because it is a referral mechanism through coordinated entry and our partners. So.
Thank you for the question, Christina. Any more questions or comments for Mike?
This is Renee from the city of Peoria. I do want to congratulate Mike on these programs. I know that Home Inc. has been a wonderful partner for a long time with the nonprofits and with the cities and towns, and not just the homeless arena, but the affordable arena. And, Mike and I have known each other for quite some time, but they do amazing work over there, and they are able to do things as a for-profit provider that some of us are not able to do as nonprofits or governments. So I, for one, am really glad that Home Inc. is out there helping out.
Very nice of you, Renee. Thank you. And I will continue and I will send messages to Kelly to get the word out as we come up with ways in which cities can continue to contribute to the cause. Really, we're probably doing some of the work on behalf of the agencies that you guys provide the funding to, just a little bit behind the scenes, but we'll continue to find ways for you to continue to help us out. So thank you.
Wonderful. Last call for questions or comments for Mike.
I have a question. This is Melanie. I might have missed it. How many landlords do you have active right now?
That's such a good question. So that $4 million went to about 800 individual landlords. And that's, ranges from the big property management firms. You guys have heard of MEB and Dunlap McGee and these types of organizations, to the individual owner operator of one rental unit themselves. So it's for almost 5,000 units of housing, but about 800 landlords. And so part of Threshold really is kind of segmenting the target audience of property owners and managers into these buckets, right? Because they're all going to have different motivations and interests and needs. And so we want to have a pitch for the large institutional REITs and out-of-state owners, and then down to the mom and pop. So we want to expand it in all areas, but we want to improve the condition of housing and the opportunities throughout the county, really. And Gilbert would be great to house people in. It's pretty tough. I live in Chandler, so Karen Bishop's on the line. It's pretty tough to find housing in some of the parts of town where people would like to live, and so any effort that you guys can make to point people our way would be fantastic.
So one of the things we were just talking about was trying to host some kind of landlord opportunity. And I think having you maybe part of that would make it, something that really would be new and interesting to offer, that people might actually attend to learn more about. So I would like the slide back up that gave your contact information, because I didn't write that down fast enough.
I'm sorry.
Madam Chair and members of the committee, we'll make sure to send these slide decks out to you.
Yeah, and just one last thing, Kelly, on that note is I mentioned earlier that threshold is not necessarily the mechanism where we will recruit landlords to accept Section 8 vouchers specifically, but we will work with the local housing authorities and the cities, because I know there are some landlord engagement efforts at the city levels. And we will want to coordinate and make sure that we're not inadvertently creating an unlevel playing field between programs. We want all the housing programs to have success, but our primary motivation is ending homelessness right now. But if we do well, eventually we can expand this and have it really rise, all the boats. So we can coordinate landlord engagement fairs. That's, I guess, what I'm saying on that. We'll do that.
Naomi.
Hi, thank you, Mike, for your presentation. I did have a question. I think you mentioned it, but I think I might have missed it. So when you're you get them housed, can you talk a little bit more about the case management that goes along with that? And who's doing that piece?
Right. So depending on the program, right? So on permanent supportive housing vouchers that are primarily for people with serious mental illness, that case management is generally provided by behavioral health organizations like LifeWell and Teros and Impact and Community Bridges, right? Agencies that already provide case management to someone who has SMI. In the homeless services organizations, where we're talking about rapid rehousing, generally, the case management is being delivered by those homeless services organizations. So UMOM, A New Leaf, CAS, Native American Connections, right? So that's, again, what we believe is our value proposition, is we enable those partners to really focus on that while we do the boring stuff, right? We'll calculate rent, we'll do inspections to make sure that these are decent, safe, and sanitary places, and we'll take care of the housing related pieces. So case management looks different for every single household that's in housing, because it's very client centric and designed around what their needs are and what their interests are. Could be helping them to attend to their physical health needs, could be mental health needs, could be substance use, could be getting back to work, could be childcare. It really is varied for each individual tenant in housing.
Mm-hmm. And then for as far as your data collection, are you going to be collecting data as far as, let's say you find a landlord, you house an individual in there. Are you to be collecting data as far as the length of time they're staying housed?
Yes. So housing retention is a big part of the story. And so, we've been operating now in Maricopa County since 1994, and I don't have it off the tip of my tongue. But I'll tell you that we have tremendous success rates, and that people in permanent supportive housing with that ongoing rental subsidy and the wraparound supportive services, usually better than 90% of the time, a year after they've been housed, they're still housed, right? It's an incredibly effective intervention that is evidence-based. And so Housing First is certainly the way that we end homelessness for people that are chronically homeless that have these challenges.
Oh, great. Thank you.
You're welcome.
Thank you so much, Mike, for your time. Greatly appreciate
Thank you.
it. All right, on to agenda item number 6. This will be presented by Rebecca Astorga. I am so sorry, Rebecca. I probably just butchered your last name. My greatest apologies there. And so Rebecca is the grant manager for Project Aware in the School Safety and Social Wellness Unit at the Arizona Department of Education. Project Aware supports the development and implementation of activities to decrease youth violence, support health development of school-aged children, decrease suicide, and improve access to behavioral health resources in schools. Thank you so much, Rebecca, for joining us. The floor is yours.
Thank you. And it's an honor to be with all of you today and to be able to share Project Aware with you. I do have our Project Aware team on the call today, Amy Castellanos, Lindsay Shoup, and myself with the Arizona Department of Education. We work in the School Safety and Social Wellness Unit, and we are the Project Aware team. So thank you. I want to be able to share a little bit about Project Aware. And so if we look at our next slide, Project Aware is a grant that's funded through SAMHSA, the Substance Abuse and Mental Health Services Administration, to advance wellness and resiliency in education. We were awarded a Project Aware grant In 2018, we're in year 4 of that grant, and we just received a second Project Aware in 2021. And so this is each of these grants has brought $9 million to the state of Arizona for the work of mental health and supporting school districts in the build and expansion of comprehensive school mental health within their districts. We do have demonstration sites that are required by SAMHSA, and we, in Project Aware 1, 2018, started a partnership with Glendale Elementary School District, with Sunnyside Unified School District in Pima County, and with Babo Kivri Unified School District, which is in Sells, Arizona, and on the Tohono O'odham Nation. In 2021, our partnering school districts, Roosevelt Elementary School District here in Maricopa County, Glendale Union High School District, also in Maricopa County, and Maricopa Unified School District, which is in Pinal County. So these are our 6 demonstration sites. They're all focused on similar goals that aim to build infrastructure for mental health. Being able to have the policies and procedures in place that support a mental health system with pathways to community mental health and behavioral health services. And also an emphasis on engagement of youth and families as part of the process to promote mental health and well-being, to really reduce the stigma associated with mental health and to normalize the conversation of mental health and wellness, and to ensure that their voices are involved in the process of policy development and decision-making. And then also to provide training and professional development, and to increase the knowledge, skill, and ability to detect and respond to students who may be in need of services and supports within the schools district or within the school system, and in being connected to the providers within the community. This is a partnership and collaboration between the Department of Education and the Arizona Healthcare Cost Containment or Access, recognizing that that is a systems change approach for this grant, but also recognizing that there's a partnerships and collaborative emphasis and expectation from SAMHSA that we are working together with our state mental health authority to address challenges and be working in partnership to identify opportunities and areas of need. And so in our partnership, we took our ADE logo and the Access logo with the sunburst, and together you see a blend to get together with the Project Aware logo on this screen. Let's take a look at the next slide. So with Project Aware, it is an emphasis with our districts. I should say our districts are receiving at least 60% of all the funding that we receive from SAMHSA. And they are working to build a comprehensive plan of activities that support the healthy development of youth and reduce youth violence. And so this is the aim and the goal of Project Aware 1 and Project Aware 2. And I'm going to, you're going to hear mainly today from my colleague, Lindsay Shoup, and she'll be taking us through some of foundational understanding of this grant and the routes for students to receive and access behavioral health services. Lindsay.
Thanks so much, Rebecca. Can you advance to the next slide, please? So I know that we'll be talking about mental health and wellness today, but I really wanted to start from a place of recognizing the incredible resiliency of youth today. I don't know if this has occurred to anyone else, but it occurs to me on a daily basis that I'm not certain I would have fared as well. If I was in school during these times, I don't think I would have adapted so keenly or been quite as clever and creative as children and adolescents are at this time. A lot has been asked of them, and they have delivered to the very best of their abilities. And I think it probably goes without saying that mental health and wellness is not a topic that was born in the year 2020. this time has really hasn't been without struggle and consequences. And really in these uncertain times, we can say that mental health and wellness has been a priority prior to the pandemic and continues to be. And while we work to navigate these ever-changing times and worlds, we know that really emphasizing mental health and wellness will better not only schools and youth, but also the communities that they're in. And for those that have little interactions with youth or schools, I would like to touch on why this is so important to all of us. If you could advance to the next slide, please. So why does it matter? How does it impact our community? Many of you know that all aspects of our community can be touched by the impacts of unaddressed or untreated mental health concerns. We know that when we look at mental health and wellness in schools, we see a great opportunity to strengthen caring communities and create healing-centered environments for both youth and perhaps even the caregivers who care for those youth. Let's take a look at the next slide. So when we're talking about mental health and wellness, I really would like to emphasize the wellness perspective as being a continuum. At any given time in our lives, we may find ourselves on this spectrum. And a lot like health, physical health, depending on our physical well-being and our needs at the time, we may address a concern in a variety of ways. As you can see here, self-care and social supports are really something that can exist at all times. But when it comes to injury or illness within the mental health and wellness field, it often requires additional assistance. Just as a broken bone might require a professional, hopefully, to take a look and tend to our wounds so that we may heal, we may recover more successfully and have long-term recovery ahead of us. We think of mental health and wellness exactly in the same way. You could advance to the next slide. So schools do present such a wonderful opportunity, a unique opportunity. Addressing and reducing stigma, in my opinion, is everybody's business. But here we have youth, educators, staff, and this close relationship with families that really present this great opportunity. There's an opportunity for intervention, prevention, family caregiver engagement, assessment, early identification and intervention, treatment, and referrals. You know, schools aren't a one-stop shop, and education is absolutely at the forefront of their mission. But really, when we are looking at mental health and wellness, this supports the goals of education. If we could advance, please. So the role of the school professional, of course, is to educate. But also what we have found is that through skill building, we are able to empower school professionals to identify those who may be struggling or in need, refer, and follow up. Educators do a lot already, and what we've done in Project Aware is work to support their current roles and what additional lenses they can use to assist and support students. We could advance to the next slide. So how do we do this? We are doing this in a variety of ways, and one of the best ways of doing this is providing mental wellness literacy education. It's a lot of words, but really we felt like this really captures the idea of literacy around mental health and wellness, both for students, but also for adults. Having a better understanding of our own mental health and wellness ultimately is going to support healthy and happy professionals. And this has been a really great success through outreach and training. If you could advance to the next slide. So how do we take this idea of identification? We often hear from educators, I am not a psychologist, I'm not a counselor, how can I do this? It's overwhelming. And what we have found is that through very accessible means, we're able to bring these ideas to the forefront of community members, professionals, and really caregivers as well. If you could advance. One of the ways that this has been done is through an example of formative policy. The Mitch-Warnock Act has been a real game changer. It has required educators, grades 6 through 12, to take a suicide prevention mental health or wellness training. There's currently 8 approved. And what we have found is that not only do 6th grade through 12th grade educators take this, we're also seeing bus drivers. We're seeing folks that are working so hard in lunchrooms. When we have communities that have their eyes out for youth, we find a greater success in identifying needs. And it has been really a lovely policy to come out, and we have been so honored to support this. If you could advance, please. So how hard is this? What does this even look like identifying? It's some of the things you might expect. Open-ended questions, screening tools within the school, collaborative conversations, identifying patterns, and most importantly, non-judgmental listening. One of the hardest skills for some adults, I know for myself, it is a muscle I have to exercise, but it is incredibly important. And it has really changed how folks are interacting with one another, both at their jobs and outside of it. And it's really created and encouraged a culture of help seeking, which is one of the most important things that can happen as well. If you could advance. So looking for signs of mental health challenges is also very important. And it can be a little bit difficult when you're working with youth and children, particularly when you're going through maybe some difficult times like a global pandemic. But what we can do is we can engage in conversations and make sure that we're reaching out to folks in case they are experiencing what we call a mental health challenge. Being able to parse out what is a potential crisis and what is a crisis helps us know what to do next. And that is part of some of the training that has happened. And if you could please advance. So identifying crisis, whether that's mental, emotional, or physical distress, has also been really assistive. It's helping school professionals, educators feel empowered to know what they're looking for and know what to do next. Oftentimes, if it is an immediate emergency, we of course recommend speaking to 911 or the suicide prevention hotline, but many schools have actually worked to create a referral policy for those that are not immediate crises. If you could please advance. So referrals. I want to speak a little bit and very briefly about what referrals might look like. Some schools are so lucky to have mental health professionals within them. But sometimes it requires an outside community mental health support to assist. Perhaps that youth needs care that needs to stretch throughout the summer. Maybe they need caregiver or family therapy as well. Or perhaps it's maybe a need that requires something other than a solution-focused approach. If you could please advance. So here's the roles of a school counselor in comparison to a community mental health support. While they certainly complement each other, they can do different things. So one of the great things that has happened recently is many schools for the first time may have school counselors as social workers on campus. Often it's only one, and sometimes they're overseeing multiple locations. So one school counselor or a social worker cannot see every child face-to-face who is necessarily in need. And like I said, sometimes those needs exceed their work. So the community mental health supports really assist with long-term care and also helping those youth be as successful as possible. Collaboration between these professionals also has been a real game changer. If you could advance, please. This is an example of how a community partner in a school district may interact. When we're speaking about tiered services, we're talking about really those most intensive services. When we talk about tier 1, we're talking about general mental health and wellness for everyone, really a basic literacy. And from there up is more intensive services. So I realize I'm running out of time, so I'll be very quick with some of these resources. If you could please advance. So there has been designed guidance, a guide that in collaboration with Access is offered on both Access's website and ours, that really helps schools understand the collaborative partnerships that are possible. There's examples of MOUs, suicide prevention postvention policy, and really how to develop comprehensive school mental health teams within the school. If you could please advance. Access has also done such a wonderful job to provide some understanding of how to access services for those who need services outside the school. Navigating places of uninsured or underinsured can be very cumbersome. And what's really great is this is being done at the provider level. If you could please advance. I'm sure you all are very familiar with Resilient Arizona. It has been a really lovely support during what has been several years of a trying time. We make sure that schools are also aware of what outside services they can provide, both to staff and families. If you could please advance. So what are the opportunities? What could happen to make this even better? Really consistent positive engagement between leaders and families, between schools and outside providers and families, really positive, consistent engagement. A closed loop referral so that we are able to see that those that need the assistance are getting the assistance and there is some type of follow through. Reintegration of students who may have had difficulties, postvention strategies, policy and advocacy, and a sustainable workforce development. It is no secret that there is a great need for mental health and wellness, and a more robust workforce is, I think, something that is on many people's hearts and minds. And as we like to say, mental health and wellness is everybody's business. We can all play a part in this, no matter our roles. If you could advance to the next slide, it will be both our website and our email. My apologies for running over.
No apology necessary. Thank you so much, Lindsay and Rebecca and Amy as well, all three of you for being here today. And I see we have a question. Christina, your question, please.
Oh, I was applauding. I'm really happy to see this additional supports, especially in the schools. I have a family member who's a school social worker in Phoenix Union, and she needs more help.
Are there any questions or additional comments for the Project Aware team?
Madam Chair, this is Jason.
Yes, Jason, please.
Yeah, this is more of a comment. I just echo what Christina was saying. It's something that I see professionally that need at the Alexander United Way around those intersection points. We talk about it here in this committee, especially that intersection point with health. But it's just something that we are always, mindful of, but I also see it at home. My partner, she's a kindergarten teacher in the Osborne School District. And, we talk a lot about, some of those additional needs that were, as you indicated, they were needed before the pandemic started, and they are certainly needed a lot more now. And just, really just helping to equip not just the teachers, and I love the example, everyone, on that campus, from, the food service folks who sometimes they see things that teachers will never see, to bus drivers, to everyone. And so I think this is a wonderful, wonderful project. And thank you so much for all your amazing work and for sharing it with us today.
Thank you, Jason. Anything else from the committee? All right, well, again, Lindsay, Rebecca, and Amy, thank you for this information. It was really vital, and just appreciate your commitment to our community and helping the children and families and our educators as well. So thank you so much for all that you do.
Thank you so much. And thank you all for your work and the opportunity to speak to you today.
Thank you.
All right. Well, again, Kelly, thank you so much for arranging these 3 incredible presentations today. Such broad topics, but all 3 that definitely impact our community. So speaking of presentations and what others may be considering, going on to agenda item number 7 are from any of the committee members requests for future agenda items or topic areas, something that you think would be beneficial to the group. And if no one has anything at the moment, please be sure to share thoughts or comments with Kelly, and we'll be collecting those and making sure that we can incorporate them in to these meetings.
Madam Chair, I have an item.
Yes, Jason, please.
It may be good to have a presentation from the Human Service Campus and Values in the United Way on the new Project Connect kind of activity. That's kind of we went on pause as the pandemic started, as everyone can imagine, but that has restarted up again. There's one happening in the city of Surprise next month. And they may not have the same frequency as they had before, or we're going to see as things kind of ease their way back in, but it may be a good update for everyone on in this group, just so you can be able to share about it and to share with the community members that may be hearing about it. So Kelly, I could work with you on who best to have that presentation, and we can go from there.
Sounds great, Vice Chair. And if you would like to share that information with me about the event, I can send it out to the committee as well for anybody who might be able to attend and support it.
Happy to do so.
Great. That's a great suggestion, Jason, especially as we can all loop back to consider things that maybe we haven't been able to make as much progress as what we wanted, since we've been concentrating on other issues connected to the pandemic over the course of the last 2 years. Other suggestions? Okay, again, if there are suggestions, things come up, please share those with Kelly.
Madam Chair, I did have 2 announcements briefly, if you don't mind.
Yes, please.
I did mention this at the beginning of the call, but for those who joined later on, I just did want to let you all know that Cindy Savarino is retiring from DES. Tomorrow is her last day. She's been a member of this committee for quite a while. So if you would like to wish her well, we can send along her email address, and we will be asking the director of DES for a new appointment to fill her position, and we'll keep you posted on that. And I did want to say this previously with the Project Aware team on the call, but I'll make sure to follow up with them. I wanted to let you all know that since Project Aware was awarded in 2018, the youth suicide rate in Arizona has dropped by 41%. And they think that that is a direct correlation to the Project Aware grant and their partnership with Access and getting behavioral health providers on school campuses across Arizona. So it's really remarkable work that that team has been able to accomplish. Thank you.
Wow, that is that's astounding, truly astounding numbers. So thank you for sharing that. You should tout that. That's a really big deal. Certainly in the comment on that too, the trainings that are now really available and a requirement in statute. That's certainly makes such a significant difference as well. So Kelly, please be sure to pass on to that team. Great job. All right, we'll go on to comments from the committee. Are there any comments or announcements by committee members? Naomi, please.
Hi, I just wanted to follow up with Jason on the Project Connect. It was a great, we just had it in Tempe in January. We had about 155 participants come, about 117 volunteers. So it was a wonderful event. So we were so happy to partner and make that happen in Tempe. Very impactful. So thank you.
Thanks, Naomi, for sharing that. That's wonderful. What a great turnout. Any other comments from the committee? All right. Well, thank you, everyone, for joining today. And if there's no more comments, we will adjourn. Thank you, Kelly. Thank you, everyone. Have a wonderful day.